Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
It was 30 years ago today when the Centers for Disease Control published reports of a few cases of a rare type of pneumonia among gay men.
It was clearly alarming.
It was something this world had never seen before.
Their condition soon had a name: AIDS.
This is the most complex illness that has ever faced this nation in epidemic proportions.
The early cases were all dying in a matter of a few months.
The probable cause of AIDS has been found. We also believe that the new process will enable us to develop a vaccine to prevent AIDS in the future. We hope to have such a vaccine ready for testing in approximately 2 years.
We're still this business of it is not a problem for most of America. It's only for those people who live on the other side of the tracks of life, those who live on the seedier side, those who live where they're morally wrong.
I believe that when one breaks the laws of nature and the laws of moral decency, we do reap it in our flesh when we violate the laws of God.
Mr. Rock Hudson
is being evaluated and treated for complications of acquired immune deficiency syndrome.
It took the death of a symbol in America to wake up those who had their heads in the sand.
I would like to stress that AIDS is a blood-borne, sexually transmitted disease that is not spread by casual contact.
The effects of AIDS on our society and healthcare system will be devastating in the years to come.
AIDS is affecting everyone now.
75% of those affected around the earth are heterosexual, so it is a disease of all of us to be concerned about.
18-year-old Ryan White, who struggled 5.5 years to overcome AIDS and prejudice, died early this morning.
Ryan contracted AIDS in 1984 when he received tainted blood clotting agent during a transfusion.
Because of the HIV virus that I have attained, I will have to retire from the Lakers.
The world stopped for a second and listened.
Every hour of every day, men, women, and children with AIDS are dying on the street or alone in a hospital.
These are lives. These are people dying.
As human beings, I think one of the things that differentiates us from other animals is that we take care of our own.
There really are no hospices that really specifically take care of people with AIDS.
Many of the people that I have known are frightened and really have nowhere else to turn.
Have nowhere else to go.
Where do you go? Who helps you? Nobody.
The streets of heaven are too crowded with angels. We know their names. They number 1,000 for each one of the red ribbons that we wear here tonight.
It's very rewarding to see a patient, as I say, go to heaven and be out of pain. But it's also a big reward when some of them can recover and walk out.
In 1988, AHF opened its first 25-bed hospice, Chris Brownlee.
The first licensed hospice in California for people with AIDS to live and die in a caring personal environment.
My name is Chris Brownlee. I believe people with AIDS and their loved ones deserve the very best care.
It is a place of great love, warmth, and spirit.
It's the most loving place I've ever been.
This is what we have. This is a family.
It's what Michael Weinstein had in mind and Chris Brownlee had in mind when they put this together.
The face of the AIDS crisis began to change. With advances in medications, patients began living longer. That's when the AIDS Hospice Foundation became the AIDS Healthcare Foundation.
We didn't want to be remembered only for being there in the last days of a person's life. We wanted to be there every step of the way.
We went from being a small political action group to being a nonprofit foundation.
I welcome you to the groundbreaking ceremonies of South Central Los Angeles Hospice.
I want to welcome you all to the dedication and ribbon-cutting ceremony of the Carl Bean AIDS Care Center.
This is a day that will celebrate the lifting of oppression in this community.
This hospice here will be a constant model for our communities to teach the rest of the communities how to love people infected with AIDS.
We're opening a new clinic at Cedars-Sinai Hospital, our 4th clinic, and we are also breaking ground within the next 2 months for a new hospice here on the west side as well.
Y'all are running 2 hospice buildings up there, and you got a third coming for.
wow, 4 medical clinics that give free medical attention to people with AIDS.
We also have a very exciting new project to raise funds for the AIDS Healthcare Foundation. And that's
Out of the Closet, a new thrift shop in North Hollywood designed to raise money for the fight against AIDS.
The largest AIDS-related retail business in the country.
I want to welcome you all here today to the opening of the AHF Pharmacy program. We're completing a circle of care.
in the life of every nonprofit organization, there comes a moment where you seriously question whether you can keep the doors open. And that is the moment that defines your true friends.
There are warriors out there. There are people willing to take the risk of trying to bring some humanity to the public policy making on this issue that threatens all of humankind.
The truth is that every single person in this country is at risk.
We are in a situation here where there's incredible ignorance, incredible fear, and incredible discrimination.
Each person has to take the responsibility for learning.
Nearly 200,000 of our fellow Californians have been stricken with the AIDS virus. Over 100,000 have already died.
It's really sad to think that they still think it's a gay disease.
There's still that denial out there with the people that it's not going to happen to me, and they need to wake up and realize
this disease does not discriminate.
It strikes rich and poor,
young and old,
Democrat or Republican,
black, white, Asian, and Hispanic.
I am not AIDS, but I am a woman living with AIDS.
Treatment for the person with HIV is not where it should be in 1994.
I had a man come to me who needed heart surgery. And he was told by the physician that he went to that he was not going to give him heart surgery because that man disclosed that he had AIDS. And the physician said, number one, I'm not taking the risk. And number two, you're not going to live that long anyway, only a few years. So I'm not going to bother.
We are growing. Our commitment is to meet the need of this epidemic, as great as that may be. And so far, we are hoping we are keeping pace with it.
Life can be very difficult when people have to take these medications.
They make you sick. They're toxic.
If a person with AIDS does not have stable housing, it is essentially a death sentence.
the potential exists for AHF to become the largest provider of AIDS care in Southern California.
AIDS is not going to go away. It is here. It's going to stay with all of us.
How can it stop? I mean, it'll stop when we found a cure.
If we do not attack AIDS in kind, none of us or our children will be around to do anything about it.
The question is not should there be protection, but how do we provide that protection? And we provide that protection by following what our government agencies tell us is the safe route. There are hundreds of thousands of healthcare workers who take those protections every day. When they follow the guidelines, no one has gotten AIDS. And those are the facts, not the fears.
It takes a lot to control AIDS. You can't conquer it, but even to control it takes a lot.
When every car drives by and they know this is a hospice, they'll know what it represents and they will be reminded of their responsibility to help.
I think that we've definitely crossed a bridge where there's a consciousness and awareness that this affects everyone in a way that we have not seen before.
We need $1 billion to help poor Americans all over the country.
If you think the cure is here, think again. The cure is not here.
I can't ever say when we hit the milestone because the milestone just keeps growing.
Treatment equals life.
Treatment equals life.
The AIDS program of the United States has failed by any measure.
President Clinton said he wanted a real war on AIDS. Where is that real war?
Action! You need political leadership.
They've given us no agents.
You need action at every level.
They've given us no preventive drugs.
Healthcare is a right, not a privilege.
They haven't even given us useful information.
Access for all.
This has to change.
1996 was a watershed year in AIDS. It was the first time that treatment actually outpaced the virus.
Across the world, people are gathering to remember the princess tonight.
This massive candlelight vigil in West Hollywood was held by the AIDS Healthcare Foundation.
A medical mystery this morning is alarming doctors. A new fast-moving strain of HIV that appears resistant to most drugs and has apparently surfaced in San Diego.
The battle against AIDS in Los Angeles and across America continues.
The nation's largest healthcare provider for AIDS patients has filed a lawsuit against the city of Los Angeles.
There was a re-release premiere for Dirty Dancing tonight, a benefit for the AIDS
Healthcare Foundation held a march here in West Hollywood tonight.
Hundreds are expected to gather tonight to pay tribute to those who have lost their lives to HIV and AIDS.
AIDS Healthcare Foundation is using World AIDS Day as a backdrop to relaunch a controversial Safer Sex City initiative in West Hollywood.
AIDS Healthcare Foundation in 1999 is becoming a national organization.
AIDS Healthcare Foundation launched a 3-week, 14-city campaign to increase the number of Americans tested.
We offer free testing to see whether or not you're HIV positive.
A push for more protection for the actors in the porn industry.
Employees in every industry are protected, except in this industry.
The AIDS virus is the focus of a new ad campaign that's creating a lot of controversy.
HIV is a gay disease.
More than 5,000 people will pass through our doors, and the vast majority are not only alive, but they're thriving.
A potential revolution in the fight against AIDS.
It is a major breakthrough in AIDS research that experts are saying could get the virus under control. Giving anti-AIDS drugs to HIV-positive people can reduce the transmission of the virus to spouses and partners by 96%.
With your help, we will bring high-tech, cutting-edge care that saves the lives of people with HIV to as many corners of this country as we possibly can. Thank you very much.
I have a minus CD4 count, viral load, and 3 months ago my CD4 was 165. I can get up in the morning and see to my kids. I can prepare their breakfast. I can supervise homework. I can work, and most of all, I can be around at least that my children see adulthood before I leave them.
1,800 babies are born infected with HIV, and 1,400 children a day die because of AIDS. 1,400 a day.
We need to wake the world up to this. I think people would care about these kids dying like flies.
We've got to continue to look at what we can do globally. That's where the epidemic is happening.
People have battle fatigue. They have been stressed out about AIDS and avoiding HIV for many, many years, and they're tired of it.
Health officials say this epidemic is nowhere near over.
The AIDS epidemic is worse than we thought.
90% of the people who are HIV positive don't know they have the virus.
The majority of people who are HIV positive in the world do not know it.
AIDS is now the #1 cause of death among black women between the ages of 25 and 34, the #1 cause of death.
This is perhaps the worst plague in human history.
The disease has hit epidemic levels in Africa.
It is the fastest growing epidemic in the world.
Zimbabwe has been hit harder by AIDS than any other country in the world.
It is women who bear the brunt of this epidemic.
When I see women lined up in saris in India waiting to be tested, it tells me that the people are ahead of the policymakers.
Not maybe, it will help to put pressure on government to do the right thing.
We've gone from being a local grassroots group to being a national organization to being a global organization, and now being the largest AIDS organization in the world.
AIDS Healthcare is fighting a battle that few others would take on. I mean, I really can't tell you how much I admire you. You're doing things that need to be done and that so few other places are doing.
You guys are doing it up there, and there's nothing that I can really say that would be funny enough or hip enough to tell you how much people appreciate what you all are doing.
People know that there's
hope to be taken care of in the process of that disease.
There's always hope. We must never ever say it's hopeless. It's not. There is always hope.
We can fight HIV and AIDS.
This is the best thing I've ever done in my life, working here and being a part of this.
You have to have a loving heart to work here.
The mission just isn't about healthcare. It's about love. It becomes personal.
All the science in the world is certainly effective within its own universe. But until you make it human, until you touch people in their heart, you're really not going to change the situation.
We're talking about ending AIDS. How are we going to do that? The real challenge, if we want to stop this disease, is to find the people who are positive and break the chain of infection and get them into care.
Living with HIV is part of life now. It's part of life. It doesn't have to be a death sentence.
HIV is still preventable.
This November be 14 years for me.
So people are living with this disease.
I know that we have it within our power, our ability to control AIDS in the world today. The question is, do we have the will?
AHF is a hero in the HIV community.
AHF is a place where miracles do happen.
Papi, dia tegat.
Let's do the job that needs to be done so that we can look back and our children can look back and say that, you know, in an hour of great crisis, this is a community that responded.
We cannot live as a society without living with every single member in our society.
All of us together, wherever we come from and whoever we are, and whatever station we come from, recognize and believe that we are all human beings on this planet and we must learn to live and love together.